Pelvic floor disorders are problems that happen when the muscles and tissues that hold the bladder, uterus, and rectum in place become too weak or too tight. Imagine the pelvic floor as a hammock that supports a garden's tools. When the hammock sags or is pulled too tight, the tool's urine, stool, organs can fall out of place or leak. The main reasons the pelvic floor weakens are giving birth, especially with a large baby or a difficult delivery. Getting older, because muscles lose strength naturally. Carrying extra weight or obesity, which puts constant pressure on the floor. Chronic coughing, sneezing, or heavy lifting, like moving furniture, that repeatedly strains the muscles. Certain surgeries or radiation treatments that injure the nerves. You can think of it like repeatedly overloading a rubber band until it starts to stretch and lose its snap. Common signs you might notice are leaking small amounts of urine when you laugh, cough, or exercise, stress incontinence, a sudden urge to pee that is hard to control, urge incontinence, feeling a heaviness or a bulge in the vagina, like a small ball under the skin, accidental loss of gas or stool, fecal incontinence, lower back or pelvic pain, especially after sitting for a long time. Try to notice if you have to go to the bathroom more often after a sneeze. That's a clue. Doctors usually start with a simple physical exam. They ask you to squeeze the muscles as if you were stopping the flow of urine. Sometimes a small ultrasound or MRI helps see the organs. Treatment options include pelvic floor muscle training, Kegels, practice tightening the muscles for 5 seconds, then relaxing 10 times a day. Biofeedback or electrical stimulation, where a tiny sensor shows you how strong the squeeze is. A pessary, a small device placed in the vagina to hold the organs in place, like a supportive bra for the pelvis. Medications for bladder overactivity. Surgery, such as sling procedures, when other methods don't work. You might try a stop sign game. Imagine you are stopping a moving car and squeeze your pelvic floor to hold the sign steady. You can lower your risk by keeping the pelvic floor strong and the pressure low. Do Kegel exercises daily. Think of pulling up the muscles you would use to stop yourself from passing gas. Maintain a healthy weight. Every 5-pound gain adds extra pressure on the floor. Eat fiber-rich foods and drink water to avoid constipation, which forces you to strain. When you lift, bend at the knees and keep the load close to your body, letting the legs do the work instead of the pelvis. Consider a quick daily check. After you finish a bathroom visit, gently squeeze and hold for 3 seconds. This tiny habit keeps the muscles active. New research is giving patients more options. Mesh-less sling surgeries use tiny absorbable stitches that reduce the risk of later mesh complications. Smartphone apps now guide you through Kegel routines with reminders and visual feedback, turning exercise into a game. Sacral neuromodulation, tiny electrical pulses to nerves in the lower back, helps control bladder signals for people with severe urge incontinence. Early studies on stem cell injections aim to regenerate damaged pelvic floor muscle fibers, though this is still experimental.